We are discovering the best you today, as we've done all month, and we conclude our series of Best Me segments with a treatment that will remove those pesky stretch marks and dark circles without going under the knife. And it's all done in less than 30 minutes. Here with the demonstration is Dr. Jamie Heskett from the WellPath facility on Madison Avenue. Thank you, doctor, for coming in today.
Thank you for having me.
So let's get started and tell us, what is Carboxy exactly?
So Carboxythérapie is the injection of CO2 gas just underneath the skin to stimulate the opening of the blood vessels and increase in oxygenation and nutrient delivery to the tissue that you're trying to affect.
And we have Courtney Clifford here, and you're going to undergo the treatment. So tell us, how are you feeling about this?
I feel confident.
Okay, this is something you've tried before, right?
I have.
Okay. So doctor, go ahead and tell us, go ahead and get started, I guess, and we'll talk us through it while you're going through this and tell us what you're doing.
So typically dark circles under the eyes are caused from a stagnation of blood flow, and that causes the darkness and sometimes puffiness of the eyes. And so if we can open up the blood flow into that area, then that will sweep away that stagnant blood and reduce the swelling, and also eventually over time reduce the dark circles, because new circulation will actually develop there. In terms of the stretch marks, we're trying to regenerate the tissue, so we're just trying to start that repair process again and then feed it oxygen and nutrients so it can actually completely or partially continue to heal.
Okay.
So the first thing I'm going to do is just basically start the machine.
And Courtney, you've done this before. Is it painful?
No.
Do you
just
feel anything?
A little bit of pressure underneath the eye, and then it slowly goes down.
And tell us why you wanted to try this.
I have dark circles underneath
Something
my eyes.
everybody worries about, right?
Yes, it's hereditary. My mom has it, and nothing works. You can only put on so much concealer. So I decided to try this treatment, and it really did help.
Had you looked into anything more severe or more, invasive?
Not at this time.
Okay.
I didn't want to go that route. So I wanted to stay as natural as possible.
Okay. And doctor, is there any pain after this? What's the recovery time?
No, so there's no downtime. Basically, there's a little bit of a sensation of pinching underneath the skin while you're experiencing it. It's a very quick treatment. It'll take less than a couple of minutes. But once they walk out of the room, they're feeling absolutely nothing. The gas completely diminishes by the time they walk out the door. And so it's as if they've actually done nothing, nothing at all.
Okay.
All right, so
let's get started.
She's just going to keep her eyes closed. We're going to let this go.
Nice that it's such a quick procedure, too.
It's very quick, so they can come sort of in and out of the office very quickly. And if you see, the under eye is starting to puff up a little bit, and it's going to get quite pink. And the pinkness really is just showing how well the blood is flowing to that area, delivering the oxygen and the nutrients, as well as sweeping away that inflammation that's there.
And this is a gas, right? You're not injecting...
This is a medical grade CO2 gas. Okay. It's used in the medical community all the time. It's extremely safe. It was discovered in the early 1900s to help people with poor circulation in their lower extremities, and there really are no sequelae from it whatsoever. The worst thing that can occur is when I stick the little needle in, you can get a little bruise, but if you're well skilled at sticking the needle in, you don't really have any bruising at all.
Got it. And Courtney, how are you feeling?
Good.
So within about 10 minutes, this swelling is going to completely go down.
Okay.
It really just feels like a little pressure on the outside of the eye, and then she can walk out and go about her day, go right back to work. Most people feel invigorated afterwards because it stimulates the circulation, and anytime your circulation is stimulated, you feel invigorated.
Talk about how often you should do this procedure.
Sure.
And at first it takes a couple of treatments, right?
Right. So the body doesn't respond to a stimulation unless you do it repetitively, and what we're really trying to do here is generate new circulation in the area that the circulation has diminished or wasn't very good in the beginning. And so we usually do this treatment once a week for about 3 to 4 weeks, and then we start to spread it out to every other week, and we keep spreading it out until you're doing it about once a month. It takes generally 7 to 10 treatments. You start to see an improvement sometimes after the first session, but sometimes if it's just dark circles we're looking at, or tightening the upper lid or the lower lid, it'll take about 4 sessions. And then the maintenance on it is maybe a couple times a year. People that have allergies and puffy under eyes tend to come in a little bit more frequently during allergy season, but it's a relatively short course of treatment.
The procedure takes just minutes to perform, and about 10 minutes later, you can already see results. Here are before and after pictures of Courtney's under eye area that received the treatment. The puffiness quickly goes away, and she can get on with her day. And Dr. Heskett will be back tomorrow with the stretch marks treatment. You don't want to miss that. And if you missed any part of this segment, you can head to our website, cbsnewyork.com. This is CBS 2 News Saturday morning, and we'll be right back.